So Preferred Behavioral Health Group really prides itself on providing quality care. We value the feedback that we get from our staff, and one of their biggest time issues is documentation. And Eleos is going to provide us with the solution that allows them to focus on their sessions and face-to-face interactions and less time on their computers doing paperwork. And we want to be sure that our documentation meets all of the standards, and Eleos provides us not only with that capacity, but we can also use it as a supervision tool to help our clinicians become the best that they can possibly be.
You know, we want a workflow in which whenever the session is over, that's whenever the work is over, right? That's whenever everything's been documented into the medical record. And you know, your team met us where we were at and helped us achieve that. Our median time for notes is somewhere around 2.5 minutes. So yeah, it's lightning fast. Whenever I show up to the clinics, one of the first things that the clinicians talk to me about is how incredible Eleos is. And so that always means a lot to me whenever I get that feedback, you know, right as I'm walking through the door, you know.
It's been a struggle to get my notes done, documentation. It was just really hard, just because it's a lot. And I have over 70 clients on my caseload, and so it makes it even harder. Since we got Eleos, it has been absolutely life-changing. I now am like 100% timeliness. It's so accurate. I have learned like how to write better notes because of the way they word it, and it's just really great.
We implemented and partnered with Eleos probably last year, and it has just been phenomenal. The quality is fantastic. You can definitely see those clinicians who use Eleos and those who do not. The core conceptualization of the note is better, and it definitely relieves the burden of clinicians in terms of documentation. We love it.
Whenever you ask the therapist what is the one thing that they feel doesn't really contribute to their work, they talk about the administrative stuff like progress notes and how difficult it is to see as many clients as they do and still have to do all of that administrative work. So when we saw Eleos, not only did we feel like it addressed the issue of progress notes, but the way it uses technology to do that feels very much like the therapist is writing it themselves based on what just happened in the session, which is about as close as you can get to the way that we need to have it done. It's not just my staff who are concerned about the administrative tasks. That's not even just New Jersey, that's a national sort of thing.
It's such an important part of the work we do, but often takes away from being able to serve the individuals. Eleos is going to be able to provide that additional time so our staff can do the important work of working with the individuals in our community that we serve.
Something that I value maybe even more than the fact that our notes went down to maybe like 15 minutes a note to less than 5, I think the dashboard says, is that I see my therapists hanging out. The culture is one of the most important pieces within our agency and something I really strive for retention. And so for me to be able to walk around and see therapists hanging out or eating lunch or like in each other's offices laughing during no-shows or break times, that's really fulfilling to me as somebody who spent those break times stressing over notes, crying at my desk, and always being behind the curve. So that's something that has brought me a lot of joy in my team as well.